one way that I think you break new ground is actually simple, and I'd like to start by talking about it. We all are familiar with the concept of, after somebody has a heart attack, of a coronary rehab. And if you have a heart attack, what happens? After the heart attack, you get referred for exercise, nutrition, stress reduction.
And insurance pays for it.
And insurance pays for it. But after cancer, there is no equivalent rehab. And yet, as you point out, the evidence is quite strong that there really should be. So let's start there. What's the case for cancer rehab?
Well, I think the case for cancer rehab is stronger than the case for cardiac rehab, particularly, well, both in terms of human suffering and the financial picture for the insurance industry. When somebody has a cardiac event and they have coronary bypass or a stent, and they're referred to cardiac rehab, and they have supervised exercise, and they learn to make that part of their life, and they're given nutritional counseling, and they change their diets, it decreases the risk of them needing another stent or another coronary bypass. But that pales in comparison to what a relapse of cancer involves. As I said, beyond the pain and suffering, in most kinds of cancer, a relapse is incurable in the mainstream. Palliative care is, which involves chemotherapy most of the time, as long as people can tolerate it. But it adds up to probably an average of $300,000 to $500,000 per patient for every relapse. Just exercise, 150 minutes a week of exercise in a person who's been treated for cancer has been shown to reduce the relapse by about 50%. Just simple stress management practice, such as progressive muscle relaxation, which comes out of yoga. If you've ever had a yoga class, it's what they often do at the end, where you systematically go through the body, tightening and then relaxing the muscles. And that allows a deeper level of relaxation. And then you just lie in savasana in sort of a deep meditation. Barbara Anderson studied this in a large group of high-risk for the relapse breast cancer patients at Ohio State over a period of 8 years. And the women who did progressive muscle relaxation every day versus the women who didn't had a 68% reduction in death from breast cancer.
Let's just repeat that. A 68% reduction just from deep relaxation.
So yes, a 68% less recurrence, and recurrence pretty much equals death from breast cancer, unless they die of something else before that. And that's not looking at nutrition, and that's not looking at social support. There have been some studies...
And it's not looking at, nutrition or social support.
Right. And what we don't know is we don't know if all of these four, I refer to them as the four cornerstones: nutrition, exercise, stress management, and social support. We don't know if they're additive or synergistic, but if they were no different from the 50% and the 68%, we can say we can roughly reduce the relapse from cancer in people who have been treated and are in remission by 50%. I believe 500,000 are diagnosed every year. Deaths from cancer is in the hundreds of thousands every year. And if we were to cut that figure in half, the savings to the healthcare industry are enormous. I think if what I would like to see is good clinical trials done with all the components that we put forth in after cancer care, which also includes doing everything possible to reduce exposure to toxins in general. That's kind of the fifth component. I would predict that the reduction would be somewhere between 50 and 80%. But if we could develop solid data of the whole approach, it's a no-brainer that the insurance industry would certainly be in their interest to fund it. So at this point, it's a do-it-yourself situation. We wrote this as a do-it-yourself manual. And we present the evidence that exists for components that are included in after cancer care. And I think that the savings to the healthcare industry and the reduction in human suffering makes cardiac rehab pale in comparison. When people die of heart disease, it's usually sudden. There's not much suffering involved. And they don't consume nearly the resources of the healthcare industry that a relapsed cancer patient does.
I find this totally intriguing, deeply congruent with what we've been doing in the Cancer Help Program for 30 years, where the four cornerstones are exercise, relaxation, nutrition, and support. What I want to push a little on, just because it's so important, is that, and I also believe that these are synergistic. I don't think they're just additive.
I think it's quite likely that they're synergistic. Yeah.
In other words, you're replacing negative biological cascades with positive biological cascades. Exactly. And the more of them you do, exactly, the more transformative it is. And you point out that an oncologist rarely asks a patient about lifestyle or environment before their cancer. They just don't ask about it. And then they don't offer anything on the other side. Whereas if it were a cardiac event, lifestyle would come up for almost any cardiologist. You know, you're going to have to change your life. But people don't do that with cancer.